How does informed consent apply to a DNR order? Imagine being in a hospital bed, facing a tough decision about your medical care. How do you make sure your wishes are respected? That's where informed consent comes into play, especially with a do not resuscitate order. When someone chooses a DNR order, they are deciding not to have CPR performed if their heart stops or they stop breathing. But this decision isn't made lightly. It's based on a clear understanding of what CPR involves and what it might mean for their health. The process begins with a conversation between the patient and their healthcare provider. The provider explains what CPR is, pressing on the chest, giving breaths, and trying to restart the heart. They also discuss the possible outcomes. For some, CPR might be successful and life-saving. For others, especially those with serious health issues, it might lead to more suffering or little benefit. This discussion helps the patient weigh their options based on their personal values and health situation. Once the patient understands what CPR entails, they can decide whether they want a DNR order. If they agree, they give their informed consent, meaning they are making the decision voluntarily and with full knowledge of what it involves. The healthcare provider then documents this decision in the patient's medical record. Sometimes, patients carry a wallet card or wear a bracelet indicating their DNR status. This ensures that emergency responders are aware of their wishes quickly. Informed consent for a DNR order is also part of a broader set of legal documents called advance directives. These are written instructions that tell healthcare providers what kind of treatment a person wants if they cannot speak for themselves. A DNR order is one of these directives, respecting a person's autonomy and right to choose their end-of-life care. It's important to know that patients can change their minds at any time. They can revoke a DNR order verbally or in writing. If someone is unable to speak for themselves, a healthcare proxy or legal guardian can make decisions on their behalf, including creating or canceling a DNR order. In elder law and estate planning, including a DNR order in your overall plan ensures your wishes are clear and respected. It's a way to make sure your healthcare choices are honored, even if you become unable to communicate them. So, informed consent isn't just a legal formality. It's a vital part of making sure your end-of-life care reflects your true wishes.